Welcome, everybody, and thank you for joining us for our PASC and Caregiver Technical Expert Panel meeting. Apologies for the sort of delay in time between our kickoff back in August and this next meeting. As noted on the slide, please say hello in the chat. We did formal introductions on our first call back in August, but just to refresh everybody's memory, if you would put your name, affiliation, and a brief one sentence summary of your expertise, that would be great to help everyone get to know one another. And I apologize for background noises here. I've got a new baby here with me. So if you can hear him cooing in the background, that's what that is. So next slide. So I'm Jenna Norton. I am the project co-lead out of NIDDK, and I'll be joined for this segment by Arlene Bierman. Arlene, you want to say hello?
Hi, everybody. Thanks for joining us. We're thrilled for you to be here with us today.
And then we just want to acknowledge our leadership at NIDDK and ARC, who are leading this project. So I think most of you at this point know myself and Arlene. We also have Kevin Abbott out of NIDDK and Jamie Shao out of ARC, whose names you'll hear often on this project. And then on to the next slide. We wanted to acknowledge our new team at EMI, who has just taken on this contract to facilitate the TEP. So you'll be the technical expert panel. So you'll be hearing from the names you see on this list. And I'm just gonna briefly pass it off to Evelyn to introduce herself and some key members of her team.
Sure. Thank you, Jenna. And you'll hear my voice too today in the coming slides. So we're delighted to be able to support the TEP moving forward. Our team is listed here. So you'll hear from me, mainly from Karen Bertadati, who is our project manager, and Savannah Mueller, who is our project analyst. Savannah is right now is the admin EMI, so she's helping run the Zoom, and Karen is running the slides. We also have Katya Shah, who's our coding SME, supporting both our work here and our value set development with our SDOH project. We have delighted to have three subject matter experts and fire experts with Emma Jones, Gay Dolan, and Dave Carlson. And we also have Sean Muir, who is our app developer. So you'll hear from us throughout, and we'll all be participating in upcoming TEP meetings as needed. So I'll move on to the next slide. So we thought, I know we asked, here is a snapshot of the TEP members to date. It's great to see that we have representation across different areas. So for us, we know many of you joining today are cross-cutting. So acknowledging that we have expertise in the TEP, again, fascinating to bring in all the stakeholder viewpoints around COVID, PASC, caregivers, patient advocacy, clinical decision-making, chronic conditions, smart and fire apps, and more. So if you haven't introduced yourself, please do so in the chat. Again, given our time today, of course, we will welcome you as we go through things to speak up, but we just want to make sure you all get a chance to say hello via the chat. Right, next slide. So just highlighting overall our governance model. I think you have already seen this in previous slides, but how this project, the MCC eCare Plan project, is organized. So as you are the official working group as a technical expert panel for our work, we also work very closely with the HL7 patient care work group that is the sponsor of the eCare Plan fire implementation. And then we also have a federal partner committee that provides guidance overall. So that will be, that has been established, and we have quarterly meetings. We also are biannual meetings. Sorry, there's different ones. So NIDDK, so the EMI team works closely with the NIDDK team for execution of the project. The management team is NIDDK and ARC. ARC also, as they go through, they are responsible for actual testing and validation of the work we are doing, the standards development. So they have been working closely with RTI and OHSU on testing the not both the fire implementation guide and the smart on fire apps we are developing through this project. Jenna, Kevin, anything else you want to add, or Arlene or Janie?
I just want to say, oh, go ahead.
No, thank
Kevin,
you for a
go
great
ahead.
introduction. I don't have anything to add.
So I just want to say is that we have a really mixed group of expertise on this call for a purpose. We know there's people whose primary interest is the, the caregiver piece of it. Others are very clinically focused, but we really want to make sure that when we develop the eCare plan, all these parts go together. That patients are reporting the symptoms that are meaningful to them, and that we capture all of the clinically relevant data elements. So I think it'll be good to get everybody on the same page. So today we're going to be focused on work we've been doing to look at, what is the evidence for caregiver facing apps. And the next time we meet, we're going to focus on, what we've identified in terms of COVID data elements and get your more technical input on what data elements should actually go in the plan. So I hope over time, like the two groups of you with very different expertise will come together as a whole, because we do want an integrated care plan.
Great, thank you, Arlene. All right, have us. Okay, so it's my turn. I will set us up for context and framing, and then hand over. Most exciting about our convening today is to have Marjorie go through the work on the caregiver app. So Karen, if you don't mind moving forward to the next slide. So I want to start these slides really to frame this TEP moving forward. Some of these slides will be already familiar to you from the kickoff the NIDDK and ARC team did in August. So I want to start just by recapping and acknowledging the various federal-led initiatives that have framed this project to date. So over the past decade, the federal government has invested in several national and open initiatives to advance the development and use of standards for care planning and care coordination activities. The primary work was initiated by ONC in 2011, so a long time ago, 10 years ago, to create the HL7, what is now the HL7 Consolidated Clinical Document Architecture, or CCDA, care plan document template. And hats off to Gay and Emma, who were very involved with that from the start. And this document template was referenced in the voluntary criterion included in the 2015 certification program. In 2014, ONC and CMS partnered to develop a national standard for person-centered care plans under the Electronic Long-Term Services and Supports Initiative. At the same time, SAMHSA began work on the Omnibus Care Plan for behavioral health care planning. And in the last 4 years, we've had a series of new projects that have been initiated to really connect the dots and advance this work. So on the CMS has the PASCO work, and we have some PASCO members also joining us today. And that work focuses on the data standards for cognitive and functional status and advanced directives. And I think they're doing more things. Again, we'll hear from all of you through the course of the TEP. We also have the Siren-initiated Gravity project that is developing data standards for social determinants of health. The Administration for Community Living, ACL, is providing funding, or has provided funding to entities to implement the gravity-defined social referral standards. ONC has also awarded 2 LEAP grants. One was awarded 2 years ago to the state of Missouri for piloting the ELTSS standard. And most recently, ONC awarded to University of Texas at Austin to test the gravity standards. And last, we have the CDC that just initiated a new project to develop an SDOH use case for chronic disease prevention. So that will tie very nicely. And I think we do have some CDC members as well on this TEP that they will be able to share ongoing work and ensure coordination. Next slide. So as we move forward with the TEP, I just quickly recap the care plan definition we are working with. So we're defining care plan as an overarching longitudinal blueprint of prioritized concerns, goals, and intervention. So the care plan is more than a treatment plan, is more than a plan of care. And most importantly, it includes, it is all encompassing, dynamic, and includes all sites and team members, most importantly, including the patient and their unpaid caregivers. Next slide. Okay, so in 2015, as part of ONC's work to promote the use of the care plan standard, they held a listening session with key stakeholder groups, including physicians, nurses, policymakers, and patient advocates. The group informed a new definition for comprehensive shared care planning, as noted here. Common themes in this definition is around having this plan be person-centered and focusing on a person's goals. And it should incorporate access to information for all key stakeholders, from clinicians to community-based organizations and providers, again, patients and their caregivers. And most importantly, the plan needs to follow the person over time. Next slide. A comprehensive shared care plan is dependent on having the right standards to represent and exchange the individual's data across systems and settings of care. This visual reminds us that our current status quo is really is about the patient themselves coordinating, being responsible for coordinating their own care across their care team members, not using a unified data model and coordinated processes. Next slide. Which brings us to the care planning framework that has been developed by the HL7 Patient Care Work Group. They developed as part of their domain analysis, care plan domain analysis model work. They created this framework that highlights the various inputs to the care planning process. This framework has been used to inform relevant projects, including the Gravity Project's conceptual framework that you see on the right-hand side, that incorporates the various activities and components for care planning, the care planning process. So overarching, we see here activities both for screening the individual to identify health concerns and problems, defining the diagnoses, establishing the goals, and then identifying and monitoring interventions, and of course, and measuring these interventions. Next slide. So another recap, the purpose and the scope of our work, again, just acknowledging we are here to build capacity for pragmatic patient-centered outcomes research by developing an interoperable eCare plan to facilitate aggregation and sharing of critical patient-centered data, home, community, clinical, and research-based settings for people with multiple chronic conditions. So, and the web link is there on the side. Next slide. And here is a recap of our project deliverables, not to go through all three of them, but acknowledging the TEP is responsible for informing the first deliverable around data elements and value sets. You'll also be looking at information models and FHIR mappings across the domains of kidney disease, diabetes, cardiovascular disease, chronic pain, and long-term COVID. Next slide. So over the past 2 years, the TEP or NIDDK and ARC have convened many subject matter experts. So this is just to acknowledge the TEP has incorporated over 100 participants from across various disciplines and subject matter expert areas. Next slide. So the TEP is focused on 2 key activities or 2 key steps. The first one is helping NIDDK and ARC to identify data elements for the multiple chronic conditions domains. To date, data elements have been identified for CVD, diabetes, chronic pain, and some cross-cutting areas that include social concerns. And of course, we are now moving on to new domains for long-term COVID and incorporating caregiver information. Next slide. The second responsibility of the TEP, also will be included in your charter, we'll talk through, is around helping us identify the right data standards. So these monthly meetings will focus on development of new data elements for those new domains and review of proposed value sets for the completed domains. And where appropriate value sets do not exist, you will also help us identify common clinical terminology code. So we're looking across mainly, the open ones, ICD-10, SNOMED, LOINC, RX norm. But again, we also have a connection to CPT. So we'll be working on that. We'll also be building novel value sets in VSAC. And we will be identifying, modifying, and development of FHIR profiles to support the exchange of these data elements. Next slide. Here's a snapshot of your results to date. So it's super exciting that the TEP so far has helped to identify over 1,100 data elements across person plan details. And you've also helped to define data standard approaches for person plan details, health concerns, and social concerns. Next slide. Okay, so then it brings us to how do we put this all together? So these are a series of slides that Jenna actually put together and we showed for the HIMSS conference this year. But I think it does a really nice job of illustrating how our work it continues to expand, right? So we started with CKD, next slide. And then we've expanded that data set to now include data standards for IHD, CHF, HTN, pain, and opioids, type 2 diabetes, and now including long-term COVID. Next slide. We continue to expand because we're now collaborating with complementary efforts, like I mentioned, PASCO, the ELTSS work, and the Gravity Project. Next slide. And we'll continue to expand on this work. So the vision is that this can also help inform areas around cancer, other CVDs, bladder health, Alzheimer's, and dementia. And next slide. And lastly, it's again, moving beyond NIDDK and ARC is how do we use these data elements and also inform FHIR for research, standards adoption, and health HIE. And also now as evolving, we talk about community information exchange or SDOH information exchange. So that is forthcoming in the market. So it's very nice to see this all come together. And I'll pause now. I know that was really quick. Jenna, anything else you want to add?
Thanks, Evelyn, for that really great introduction and recap. I just want to clarify because we have had multiple TEPs running, just in case anybody's confused for those who are newer to the project. So the existing TEPs have identified multiple data elements, and then this TEP will expand on those data elements in long COVID and caregiver concerns. So that's our ultimate goal. And today we're starting with the caregiver focus. And as Evelyn mentioned, we'll be expanding to think about some of the COVID data elements in our next meeting. So thanks again, Evelyn, that was great. And I will pass it back to you.
Thank you, Jenna. Well, I'm happy now to hand it over to Marjorie Kelly to go through her presentation. Marjorie?
Sure. Hi, everybody. I'm Marjorie Kelly. I work at The Ohio State University as a nurse scientist there. And this summer I worked as a postdoc fellow and helped AHRQ under the direction of Dr. Arlene Bierman. And we did an environmental scan looking at what's already out there in caregiver apps and in care planning. Next slide, please. Just a shout out to the team because none of this work could be done without all this input from all these wonderful folks. And I'm going to apologize. I'm going to run through this very quickly because towards the end, we're going to need, we're going to have a little interactive phase where we're going to actually ask you for your input. So please bear with me. I think these slides will be available and there's some interactive links if you want to find more information about some of the things that we have done. Additionally, if anybody needs to reach out to me, please feel free to do so. I put my information in the chat. Next slide, please. So our objectives of this project was to do an environmental scan. And basically we did a review of the apps that are out there. And we also did a scoping literature review. We really wanted to find out what's out there and identify any specific needs, features, or functionalities around caregivers, providing care, and any interoperability that might be available in some of those apps. Next slide, please. So just a little background. I know we're all coming at this from different focus areas, but just to make sure we're really aware, care recipients are sicker and they have increasingly complex care needs, and our caregivers are suffering. physically, mentally, and also from increased prevalence of financial and social challenges. Next slide, please. And that sets up a perfect storm, particularly when we canvass caregivers about the challenges of coordinating care. It's becoming increasingly difficult. Next slide, please. So what did we do? We did this environmental scan, app review, and a scoping literature review. Next slide, please. For our app review, we talked to technical experts in the federal government, state and local governments, national organizations. We looked in the Smart App Gallery. We looked at electronic health record vendors and their app stores. We identified apps in the literature and also got some clues from other places, specifically HL7, doing some interoperability work there, looking at some of the things that they had available, and were there other clues where we could look to find apps. Next slide, please. For our literature review, we did a systematic review. We looked in 6 databases, but because it's a scoping literature review, we really wanted to see what's out there. So we also looked in the gray literature. We did hand searches of bibliographies, and then also government and industry policy documents. Next slide, please. What did we find? What did we find? We found 15 apps. Now, I know we didn't look in all the commercial apps, because we wanted to see what the evidence was. And when we actually dug down deep to see caregivers, care recipients, and electronic health records and healthcare providers, where those things intersect, there weren't many. What was available was not freely available. For example, Health Hive is a privately held company and it's restricted. You have to pay for that application. Harmonized Care was a collaboration between Geisinger and Merck. And if you're a Geisinger patient, you have access to it. And then the VA had some interesting things that they were working on, but they weren't ready for prime time because they had problems with integrating in the EHR and privacy and legal issues. So in a nutshell, there's not much. Next slide, please. Similarly, in our scoping literature review, even though we looked at almost 6,000 articles, we only found 34 articles, only 3 of which were quantitative research. Most of what we found were usability studies, feasibility studies, and then we did find quite a lot of information about what caregivers need. And that's the qualitative or the needs assessment. Next slide, please. Specifically, most of the domains that we found were around cancer, some were around dementia, a few were in general caregiving, but no research really focused on care planning or care coordination. Even in that general group, it was specifically about, one was about helping decrease stress, but none really focused on care planning or care coordination. Next slide, please. So we did find quite a little bit of information about caregiver needs and what were the needs of these caregivers when we looked at providing care, when we looked at their needs for their own self-care, and then also the third bucket was some of the desired features and functionality that caregivers wanted in their apps. We're going to go over some things now in these 3 buckets, and we're going to ask for your input in 2 of those buckets. We're going to ask for your input in the providing care bucket, and then we're going to ask for your input on mobile health app features and functionality. Arlene or Jenna, do you want to talk about how the best way, how we're going to do this? Next slide, please.
So I will let, I think Karen might be the person who can best speak to exactly how we'll do the polling.
Yeah, so we have some Zoom polls set up, and I think, Margie, if you wanted to talk through any of these before we launched a poll, you're welcome to do that. But also throughout the time we're on this slide, if anybody has any input they would like to share that's maybe not included in this current list, you're welcome to do that in the chat as well.
Yes.
Yeah.
Oh, go ahead.
No, I would like to, encourage everybody to, comment, give ideas in the, in the chat. If there's things missing, please add that. And, we're not doing this as a Delphi process, but just really to start a conversation of what are the critical things we should consider in developing the caregiver app. And for those of you who are clinicians and not, caregivers or patient representatives, we also want your perspective on what would help you communicate better with the people and their caregivers that you take care of.
And thanks, Diana. I saw you noted in the chat too, a question about whether Hugo Health was considered. So we recognize just the, we did try to comb the gray literature and ask folks for recommendations of good caregiver apps. If there's one you know of that you think is a strong example of a caregiver app that enables access to data for caregivers, we'd love to know about that, especially if we missed it. So please add that to the chat as well if you think of that. We would greatly appreciate your recommendations there, since not all of these are publicly available, and some of them just may not have come up in the search methodology that we used.
We specifically were interested in how care was integrated and how care was coordinated. So between the caregiver, the care recipient, and healthcare organizations or healthcare providers. So we specifically looked at apps and we were really trying to focus on any research that had been done in those areas. These next 3 slides that we're going to talk about are really the needs associated with providing care from the caregiver standpoint. These were the items that caregivers noted from the literature that had to do with care coordination. Many of them were identified in several different needs assessments. So let me just kind of read through these, and perhaps if people can think about care coordination from their own standpoint and put that in the chat if there's anything missing, that would be really beneficial. So caregivers really felt like integrated apps that were integrated with the healthcare system could help their care coordination. They wanted the ability to complete questionnaires at home and in an unrushed fashion. They wanted help coordinating equipment. They wanted help coordinating contacts and contact information for quick reference. They wanted information that that connected them to special services, whether that was first responders, respite care services, or some specialty care services. They were interested in coordinating and improving relationships with their healthcare providers. They were interested in some mechanism to coordinate feedback from their healthcare providers, and they wanted instantly, don't we all? They wanted automated data entry and reminders and prompts of upcoming things, whether that might be medication, whether that might be changes in medication, whether that might be certain care coordination features, or even calendaring of upcoming appointments. They wanted one-stop shopping. They wanted the information all in one place. They didn't want an app for my chart, an app for social services, another app for something else.
Great, thank you, Margie. So we are going to launch the poll now, and it will ask you to select the top 5 most important caregiver needs from the list. So multiple choice, and that will help us prioritize some items on this list. So I'm launching the poll now. All right, we'll give it 10 more seconds. All right. Closing the poll. So everyone should be able to see the poll shared. So it looks like integrated app with the healthcare system is quite important, along with the one-stop shopping experience, followed by information connection to support services, as well as feedback from healthcare providers and important contacts and contact information for quick reference. Any other feedback that folks wanted to contribute before we move on? All right.
Great, thanks, everybody. Again, this is more on caregivers' needs associated with the provisioning of care. So what kind of support do caregivers need when they provide care? They wanted support for physical and emotional needs of the care recipient. They wanted support with rehab, and they wanted support with activities of daily living. They also wanted decision-making support, particularly one that was particularly noteworthy was in the end-of-life care. They wanted support with medication management, tracking and monitoring of the care recipient, their mental, emotional, and vital signs was important. And caregivers wanted support specifically that was tailored to their care recipient's need. Family and personal relationships were concerned, and they wanted support with that, whether that be for asking help, safety, communication. And again, they wanted their support always accessible. So perhaps we can put up our poll again. And just as a reminder, these are a synthesis of caregivers' needs. We don't have this, we haven't done this yet to identify clinicians' needs, but we certainly are acutely aware that if it doesn't fit in clinicians' workflow, it's never going to get done. So if there are specific things that you're thinking about, please don't hesitate to put them in the chat.
I will give the poll 10 more seconds. Thank you everyone who are typing some open-ended responses as well. All right. So here are the results from the support poll. So much closer results, but you can see that tracking and monitoring of care recipient is fairly important, medication management, and I believe somebody commented also that that should include medicine reconciliation, and then decision-making support, support with rehabilitation, daily activities are also important.
Mhm. Yeah, great. Thank you. Next slide, please. And this is the final one under the provisioning of care. And these were the information needs of caregivers. Again, if you're a clinician or if you're a care recipient, your information needs might be a little different. But these were the caregivers' information needs. So just adjusting to the new role, information on the disease condition, symptoms that might be, or behavior with the disease condition, kind of when to seek help, when do I ask for help? Information around the changing nature of caregiver was important. Financial and legal services to help caregivers. They wanted information about financial assistance. They would like their education and their training on demand, asynchronously provided, please. They would also like information about community support. So transportation, where to find transportation. There was some discussion about community reintegration. Content tailored again for the caregiver recipients' needs. They needed it simple and easy to understand. They didn't want us to give them research articles, and they wanted the content to be evidence-based, but they wanted it up to date. Multimodal delivery was important. And again, the always accessible, always on was how they wanted their information. So maybe we can put the poll up now.
Yep, and just one minor note. So each question, the maximum limit are 10 items. So we spaced these 14 items across 2 questions, but please select 5 from the 14 total. Give everyone a few more seconds. here are the results. So financial and legal services, definitely front runner, as well as information on symptom behavior safety, when to seek help. And those are the top three for sure.
Great, thanks. Next slide, please. The next few features here, or next few items here, are the features and functionality of a mobile app that were desired by caregivers. Again, these were things that were desired by caregivers and might be completely different than what a healthcare provider might need. We encourage you to write in the chat what your needs are, so that we can understand those a little bit better. But these were the features and the functionalities: easy to learn, easy to use, integrated with our phone contacts, the ability to report care recipient status, symptoms, and get feedback quickly, task reminders such as appointments, med management, integrated with other platforms, the electronic health records, smartwatches, pharmacy, ability to share information with family members. There was some discussion in several papers about integrating music and other entertainment. There was tracking patient symptoms, tracking caregiver issues over time. So whether that's caregiver stress, caregiver burden. They wanted it customizable. They wanted the app from a trusted source, and they numerous times the content, can I trust the content? They wanted the data secure. They wanted it integrated across different healthcare systems, not too much information. They wanted the information just in time, and they wanted the right information. Affordability was a concern. Font and screen size was a concern. They wanted it to be sustainable, so they didn't want the app to go away or become obsolete in a few years. They wanted help for people who were digitally naive or didn't have a lot of experience using smart apps. They were concerned about reducing their time with their physician. They were worried that using this app might actually reduce the face time with their physician. So they wanted to figure out ways that they might be able to prevent that from happening. They wanted a clear perceived benefit, and they wanted automated data entry, as well as customizable or personalizable features and functions. So let's go to the poll.
Oh, this one we were going to have a verbal discussion because there are a lot of.
Sorry.
Yeah, there was too much to poll. So we just like to hear people's ideas about, what you think we should focus on as we, design this in terms of features and functionality, and also anything that you think is missing from this list.
So there were a few comments in the chat, ability to export information to email or printing, and then a place for caregivers to archive or journal their caregiving journey. So Karen, if I may ask you to elaborate a little bit on that last comment about archiving or journaling, is that something that you envision would be sort of, free text, almost like an actual true journal, just writing notes? Or, are you thinking, because I think one thing that we would like to explore with this project is what kind of data elements we might want around, tracking some standards on the caregiver experience, caregiver burden and caregiver stress and things like that. So just curious what you were thinking there.
Sure, thank you. So I was thinking that, oftentimes caregivers, they go to blogs and, they use all kinds of ways to really journal their caregiving experience. And, that can be incredibly therapeutic too. So that's what I was thinking, kind of more of a, as you said, freedom to just write in whatever they wanted to. So yeah, that's what kind of free text. It can be incredible. It's an effective stress reduction technique. And so that's the context in which I was thinking about it. And I think it also gives people an ability to kind of flip the switch to thinking that there are many positive aspects of caregiving too, and we tend to focus on the negative. But this gives them an opportunity too to kind of reflect on some of the positive aspects of their journey.
Thanks, Karen. That's helpful.
This is Ian Plummer at CDC. Just wondered about a couple of general considerations, including simplicity. Sort of tied to that is sort of usability, especially for people who are less literate or might be excluded, are particularly vulnerable. Sort of just ways to address that. And then secondly, kind of with increasing AI and everything, and trying to be very contextual. Like, are there ways to think through like varying it so that you kind of hit the right person, the right time, the right place with the right information that they need at that point, so it's kind of flexible over.
I think that the concern that it might reduce time with physician is a significant, could be a significant worry for certain people.
Could you elaborate on that a little, Jerry?
Yeah, I was going to ask that. Thanks.
I think that some caregivers may assume that this is going to replace time with talking to a physician or having contact with a physician. So I think that initially it should be made clear that no, that there's no intention for this to be doing that.
I gotcha. Absolutely. Yes, we certainly don't intend to do that at all. This would be, I think, supplementary and providing access to information and making sure it's accessible, sort of regardless of direct one-on-one contact with the clinician.
One thing that was very apparent going through the literature was this idea of relationships and how mobile health or digital health applications could enhance relationships, whether that's relationships between the caregiver and the physician, the care team and the care recipient. But this kind of overarching of relationships was really important to many people.
I think for the interest of time, if there are no objections, Margie, should we proceed to the next slide?
Sure, for sure. We're almost done, folks. Sorry. So these were self-care needs the caregivers identified. And this is a little bit beyond our scope right now. Of course, we'd like to offer this in some type of an app further down the road, and it's not to minimize it, but we felt we needed to, in terms of care planning, we needed to focus on those first two buckets first. Next slide, please. And just to thank you to everyone who's participated. And just in summary, we've identified some features and functionality that are important for caregivers, and you've helped us identify some of your needs. Again, feel free to continue to write in the chat. We did not find any apps that met our needs for care planning. And so there is a great need out there, and I think we're doing a great job in thinking about how we can develop this and having all our stakeholders come together so that whatever the end result is, that it's usable and feasible for everyone involved. So thanks again, and I'm happy to take any questions.
So there was a question from Tim Carney in the chat about whether we have an intentional metadata capture strategy with the app. And so, yes, I think, throughout this process, kind of, which has spanned back to 2015, we've tried to think about sort of what types of data we want around each data element type. So when you're thinking about a specific test result, you don't want just the test result, but also the date the test was taken, the type of tool that was used to run the test, or the type of device used to measure so those types of pieces of information that kind of go along with each data element. We've been tracking that. And a lot of those are sort of embedded within the existing fire standards. And so that's been sort of our approach thus far, is using fire to kind of capture those sort of pieces of metadata. But if does that answer your question, or did you have something else in mind, Tim?
I think that's a great start. I think the other piece that I was probably thinking about adding to that would be collecting the kinds of data that would help you demonstrate that this intervention strategy is actually having an impact on behavior change or outcomes. And so thinking about how to build up that justification, ROI, through the use of metadata gathered on people using it and how effective it is in changing behaviors, et cetera. So I didn't know if you
Gotcha.
were...
So yeah, so our testing thus far has been, I think, more in the feasibility realm. We haven't yet started testing these apps in terms of actual changing outcomes, just because it's so early in this process. Right now, we're kind of still at the questions of, can we pull this data, and when we pull it, how accurate is it, and is it the right data that we're pulling to be helpful for the various audiences. So in our connectathons and also in our real world testing, it's been more sort of feasibility, usability, that we've, technical feasibility and usability for the audiences that we've been addressing thus far. So we haven't gotten there yet, but that is sort of our hope in the long term, of course, is that we can start to use these apps and the standards that we're creating out of these efforts to actually to show that improved access to data and improved care coordination can support improvement in actual health and behavioral outcomes.
One thing I would just observe is in my years at NCI, incredible amounts of discussion and presumably lots of efforts were spent on care planning. And I think that probably the care planning was oriented toward the patient's care planning, but I suspect there was quite a bit of a contribution of caregivers in that wouldn't necessarily be represented in the search that you did. I'm not sure about that, but I just know that there was lots of funding, lots of attention to care planning, but it was almost always patient care planning. And sometimes the caregiver never got even mentioned.
That's great, Jerry. If you were able to direct us to anybody who might still be, or who could speak to what was learned out of that work, that would be fantastic.
Yeah, I have a colleague who was also there, and I can ask her to. I'll ask her about that.
And as you can see in our results, in terms of the digital realm, there's nothing there. This is the caregiver's perspective, and we're at needs assessment. There's not research that's been done or apps developed that have made it to market. So we're at the infancy. So any information would be helpful. Thanks.
Thanks, Marjorie. This is actually Evelyn, and I could follow up with you after. One thing too is that, as noted, is a lot of the apps, well, the ones I'm familiar with have been created domain specific. So I have seen cancer care planning apps. So that listening session that was held by ONC in 2015, we had a subsequent evaluation of market solutions to support care planning. So I think to that part is maybe, and also what Jerry is alluding to, that they could be very specific to domains and not touching the chronic disease. But I know there's also diabetes activities as well. So I know I have 3 minutes, so I'm going to go through the TEP charter and co-chair nomination. So you've all received a TEP charter that outlines as a TEP your roles and responsibilities, the expectations for your participation in the TEP, how the TEP will be administered, and our key contacts. Next slide. So what we would like to mirror what the EMI team has been supporting for our other committees we oversee, where we establish co-chairs. So we would like to establish co-chairs for this TEP to help guide the meetings, help us facilitate discussion topics, and really, help advance the work. And so as part of the administration working with the co-chairs is that you will meet, the responsibility will be for the co-chairs to meet with the eCare plan project manager, Karen, between TEP monthly meetings to review and finalize the TEP meeting agenda and approach as needed. And this process, again, this is our experience with the Gravity project that has 3 large committees, and some of our CDC team members are on the call here as well. So we find it's helpful to have chairs to help inform the monthly meetings. We want this to be valuable to you as well as all of your subject matter expertise and bringing it to the table and having you also directly inform the work. So as a result, we are asking for co-chair nominations. We would like one to be nominated for the PASC as a PASC co-chair, and then one looking at it from the caregiver functionality as we just went through. Of course, you're also welcome to self-nominate. Please send your nominations to Karen. Her email is there on the slide by November 30th. So I know this is a tight deadline. This is before we meet again, but it would be great to get your initial feedback and thoughts for a co-chair, and then we will call a vote. A formal vote will take place at the next TEP meeting in December. Any questions? Okay. All right, with 1 minute, next slide. I think we have next steps. Okay, to you, Karen.
Yes, just really 2 brief notices. So please send your co-chair nominations to me. It'd be fantastic if you included full name, the expertise, the type of co-chair, and then just a brief bio for your nominee. And then the second step is we will be posting all our meeting notes, the slides, the recording, all the meeting materials moving forward on the Confluence, and the link is embedded in this slide and will be shared out via email after this call. If you have any trouble accessing that, please do email Steve Bernstein, who can help with that. And just to confirm that the next TEP meeting will take place December 7th. It's a Tuesday, and that meeting invite should be on your calendar. And if it's not, feel free to email me as well, and we will ensure that you have it. And with that, that is our meeting. Thank you so much for attending and for your thoughtful engagement.
Thanks so much, everyone.
Thank you.
Thank
Thank
you.
you.
Good afternoon.
Afternoon.
Good afternoon.